I'm Dr. Fiona
Recording in
Atwell,
progress.
and welcome to the WHO Africa Media Press Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can select the language in which you want to hear this press conference by turning to the bottom right of your Zoom application, selecting the globe and choosing your language. We shall also give you a chance to ask your questions either live or using the Q&A function of your Zoom application. And now, joining us from Brazzaville, Congo, we have the Regional Director of WHO Africa, Dr. Matshidiso Moeti,
de la région africaine de l'OMS, le docteur Moeti.
who I will now give the floor to
À
let
laquelle je
her
donnerai
introduce
maintenant la
our
parole
other
pour qu'elle puisse
panelists.
présenter les autres panélistes.
All our colleagues in the media and everyone
Alors,
watching
bonjour,
online.
chers collègues des médias et tous
Bonjour,
qui nous suivent en ligne.
from here. I'm very pleased to be joined by the Honorable
Alors, je
Minister
suis
of
très heureuse d'être rejoint par l'honorable ministre de la Santé de Lesotho, Monsieur Semano Henri Sekatle. Soyez le bienvenu, Monsieur le ministre. Nous attendons avec impatience ce que vous avez à nous dire sur le déploiement des vaccins COVID-19 au Lesotho.
Seydoux, the Ambassador for Global Health at the Ministry for Europe and Foreign Affairs in France. Bienvenue et merci beaucoup, Madame l'Ambassadeur. She is going to talk about France's decision to share COVID-19 vaccine doses with other countries through the COVAX facility. There have now been more than 4.7 million COVID-19 cases and 128,000 lives lost on the African continent. For the past 3 weeks, cases had declined, but this week we are seeing an increase, in fact, of 17%, with 65,000 new cases reported. While it's too soon to say if Africa is seeing a resurgence, however, we're seeing increases in a number of countries. We are monitoring the situation very closely. And we see that we are balancing on a knife edge. South Africa accounts for almost a third of these new cases, with 2 out of 9 provinces already experiencing a third wave, but in fact, most of the provinces seeing an increase in the number of cases. Population fatigue in adhering to preventive measures, the circulation of variants, and cooler weather in Southern Africa is driving people indoors and could be contributing to these increases. We are concerned that increases in South Africa could spread to neighboring countries, as has happened before. And note that Namibia and Zambia, for example, are among 11 African countries experiencing an upward trend in cases. So this makes the rapid rollout of COVID-19 vaccines all the more important. Almost 6 months after the first COVID-19 vaccination campaign started globally, less than 2 doses per 100 people had been administered in sub-Saharan Africa. At a minimum, Africa needs at least 20 million AstraZeneca vaccines by mid-July to deliver second doses to everyone who received their first shots. Africa needs vaccines now. Any pause in our vaccination campaigns will lead to lost lives and lost hope. Another 200 million doses are needed so that the continent can vaccinate 10% of its population by September this year, as called for by the WHO Director General at the World Health Assembly this week. As WHO, we are appealing to countries that have already vaccinated their high-risk groups to significantly expand and bring forward their pledges and actions to share doses. Dose sharing is an urgent, critical, and short-term solution to ensuring that Africans at greatest risk from COVID-19 get gold standard protection. We also appeal to manufacturers to ensure that countries can contractually give doses to the COVAX facility. Vaccine manufacturing in African countries offers much promise. Investments should take a long-term view, including vaccines for other priority diseases, using different vaccine platforms and pursuing coordinated multi-country approaches. Ratifying the treaty for the African Medicines Agency is a key step that all countries on the continent can take to strengthen the regulatory environment for local production. Finally, next Monday is World No Tobacco Day. Tobacco kills half of its users, and globally every year, around 1.2 million non-smokers die from exposure to tobacco smoke. This year, we're urging tobacco users to commit to quit, and we are working with countries to improve access to supportive services such as toll-free quit lines, nicotine replacement therapy, and text messaging and other information tools. Reducing tobacco use will save lives, save money, and create healthier societies. So I look forward very much to our conversation with our two honorable panelists today and with you, our journalist colleagues. And thank you very much for joining us.
Thank you very much, Dr. Moeti. And now we turn over to Lesotho. Honorable Semano Sekatle, how is Lesotho's COVID-19 vaccine rollout going?
Thank you very much. Good day and greetings to you, Dr. Moeti. I thank you for inviting us to speak today. COVID-19 vaccines, we believe, are the last straw that will break this monster's back. Lesotho's vaccine rollout would not have happened if it wasn't for us engaging into developing a comprehensive plan that would guide the vaccination program. I thank all the people who were involved, and many to count, actually, to develop the Lesotho National Deployment Vaccination Plan. Back in March this year, we were expecting about, or at least 132,000 doses from the Covey facility. We only received 36,000 doses. Understanding the existing challenges in terms of supply, we adopted the attitude that half a loaf is better than no bread, and that a bird in hand is better than two in the bush. I'm glad and delighted to report that the 36,000 doses that we received, we have to date managed to vaccinate about 36,819 people. We have strictly followed and adhered to our national deployment vaccination plan. We have now partially covered the first phase of that plan. This phase had prioritized our frontline workers, particularly the health workers, including village health workers, the vulnerable people with comorbidities. We are gratified that today we have been able to vaccinate 95% of our health workers. The doses that we have, or we had, have been wiped out. We are now stuck. On the other hand, the demand for vaccines has shot up. Our health centers had to return people without being vaccinated. It is simply embarrassing, to say the least. But thanks to France for coming to our aid. The recent donation by France to the COVAX facility will save us from this embarrassment. We encourage and appeal to all other countries with surplus doses of vaccines to do likewise. In fact, to do what is the right thing to do, to save lives and to restore normalcy in the social, political, and economic activities of the world. Anyway, it is only the sensible thing to do. In conclusion, I must thank you, Dr. Moeti, and your staff, the COVAX facility, UNICEF, and in anticipation, the AU and the AFAT facility. And indeed, the many people who are doing everything in their power to ensure that the world gets the vaccines we so desperately need. Thank you very much.
Thank you very much, Honorable Minister of Health from Lesotho. Yes, we hear you loud and clear, and thank you for that excellent breakdown, a mix of success, but also a call of appeal to wealthier nations. Now, Your Excellency Stéphanie Seydoux, can you please tell us about France's decision to share COVID-19 vaccine doses with Africa?
Merci beaucoup pour cette opportunité.
Thank you very much for this opportunity, allowing me to address this assembly. It's an honor for me to speak after the Minister of Health of Lesotho, that I thank for his kind words. Of course, the COVID crisis highlighted the difficulties we have in equitable access. It is one of the conditions to meet this challenge and to win against COVID. And even if Africa seems to be spared compared to other regions, of course, Africa should benefit, as other regions, from all the tools that have been established to fight against COVID, and also take the opportunity of this respite, this lull, to expand its vaccination campaign. And for this, we need a number of tools, diagnostic tools, therapies, and protective equipment, and vaccines, of course, that I'll refer to now. From the outset of the crisis, France, through its president, President Macron, set up a mechanism, a multilateral mechanism to ensure a fair access, ACTA, access for COVID-2 accelerator, ACT, and it also highlights the very important dimensions enhancing health systems in countries. And it is very relevant to focus on this at the national level to fight against this crisis. And we also need to disseminate the tools we refer to. ACTA has a COVAX facility under its aegis that facilitates access to vaccines, and we can say that today this facility has well advanced. 72 million doses have been provided for lower and middle income countries. France was the first country to see the importance of sharing these doses. This is what we did in April, and as we speak, tens of millions of doses, have been shared. And the first batch, 100,000 doses, have already been rolled out. the President confirmed that we would deliver 500,000 doses before the end of June, and a greater figure before the end of the year. When he addressed the Global Health Summit on the 22nd of May, the President of the French Republic said that there should be accompanying measures. It is high time to share. It's very important, and we are delighted that the mobilization efforts that have been conducted by France are bearing their fruits. The EU Commission has referred to 100 million doses that would be provided in 2021, and increasingly European countries are taking this path. France will continue to promote this approach at the G7 level, and there's a number of countries that are very interested by this solidarity approach, this path of solidarity that will enhance the response to the crisis at the global level. I would like now to speak about vaccination. As you're well aware, France wanted to use the COVAX facility because it meets the fairness and effectiveness conditions with jointly with the support of WHO. There are a number of criteria that have been taken into account in COVAX, and this enhances also the relevance of delivering doses in all these countries. I must recall that the objective of France is that the doses should be firstly given to the first responder, health workers that are more exposed to vulnerable or high-risk populations. We are envisaging the possibility of seeing how these doses with COVAX could support the humanitarian efforts that have been identified. And I would like to highlight the last point. There are two directions that France has highlighted, measures that France deems important to increase access to vaccines. And it was highlighted during the World Health Assembly on the 24th of May. So firstly, vaccine, encourage countries to eliminate obstacles for delivering vaccines, and enhancing manufacturing capacities, and notably in Africa. There's a European initiative, an ongoing initiative in which France will participate, and we are very interested by this third path that has been proposed. Dr. Nkongo Weyala, that has put an emphasis on the transfer of technology and know-how by using the experience of WHO and also the medicine patent pool, its partners, that France has been supporting since its creation. And there's a hub that has been established for mRNA that is being supported by France. I'm referring to the fact that the President of the French Republic, President Macron, that is today in Rwanda, will go to South Africa and will meet at the highest level with President Ramaphosa, and proposals will be made during these exchanges to see how we can enhance the manufacturing capacity for producing vaccines in Africa. France supports other innovations in the health level that are being highlighted during the World Health Assembly and that are being presently discussed during the Assembly. I thank you for your kind.
Thank you very much, Your Excellency Stéphanie Seydoux. And now that we've heard from our panelists, it's your turn to ask your questions, dear journalists. And to do this, remember, you can use the question and answer function of the Zoom application. And also remember that you will need to provide a name and the news agency that you represent to have your question answered. Also to note that on hand we have Dr. Nsenga Ngoy, the Incident Manager for the COVID-19 pandemic, and Dr. Richard Mihigo, the coordinator for Vaccine Preventable Diseases Program, both working at the WHO Regional Office for Africa. So to start us off, I'll go to you, Rhoda Odhiambo from BBC Africa, to go live with your question.
Thank you, Dr. Tuhebwe. My question can be answered by either Dr. Moeti or Dr. Ngoe. So I'll first start off by looking at how countries are redistributing, sending back the vaccines to COVAX because of poor uptake within the communities in these countries. So how many African countries have returned the COVID-19 vaccines to COVAX? And in terms of numbers, how many vaccines are these and from which countries? And my second question is looking at how these African countries are struggling to roll out vaccination programs because of widespread misinformation and people being skeptical and hesitant to taking the vaccines. What help can the WHO offer to these countries to ensure that the vaccines are used and not redistributed if the continent has to achieve herd immunity according to the timelines that has been set? Thank you.
Thank you very much, Rhoda. So I'll request Dr. Mihigo to answer the question on the doses that have been returned by countries to COVAX, but then I'll turn to Dr. Moeti and the Honorable Minister from Lesotho to tell us what we can do to ensure that we get rid of this hesitancy.
Thank you very much, Dr. Tuhebwe. With regards to the number of vaccines that have been so far returned to the COVAX facility, we have two countries so far. The Democratic Republic of Congo that have returned 1.3 million doses, and which fortunately were redistributed successfully in 5 countries, which had a high capacity of the absorption and the use of these vaccines before they expire. So those were sent to Madagascar, Central African Republic, Angola, Ghana, and Togo. The second country is South Sudan, that also has notified the COVAX facility of some doses that could potentially expire before they are completely used, and there is currently negotiation with the COVAX Secretariat to see how these doses could be reallocated to another country. And I'm sure Dr. Moeti will come back to this, because this has been one of our great big message that we are sending to country. As much as we can, our recommendation is to encourage, and we do support country to use up the majority of the doses that they have within the country, and not send these vaccines back to other countries. We've heard from the Honorable Minister from Lesotho how desperate countries now are to get additional doses. So that has been our position, and we are doing our best to support countries to use up all the doses that are currently available. Thank you, Dr. President.
Okay, so if I can take up where Richard left off, I think it's true that, of course, this happened with these countries, and let me emphasize that when a country has not been able to use its vaccines, of course, we'd like to encourage that the vaccines be used, but it is very good then that they gave an early signal in time for the vaccines to be redistributed to other member states that were ready to deploy them, because what we absolutely don't want is for vaccines not to be used in countries right up to the time that they expire their shelf lives. I'd also like to emphasize that actually the picture is very mixed on the continent. We've had 8 countries that have used up 100% of their COVAX doses. That includes Lesotho, countries like Botswana, Eswatini, Namibia, Rwanda, etc. And we've got other countries that have used up over 90% of their doses. 19 countries have administered more than 50% of the doses they received from COVAX. So the countries have done a lot of work to prepare and to deliver when the time came for them to receive the vaccines. So what can we do to ensure that reticence, misinformation don't influence people's willingness to come forward and be vaccinated. This needs very strong communication campaigns. In fact, these have started to be put in place in all of the countries. And it needs person-to-person direct communication with people and through channels which the people have confidence in. So we've seen countries work through church groups, work through associations, work through women's groups to make sure that people get the message from those that they trust about the vaccines. We also have, as WHO, with our partners, a campaign, a platform that we call the Endemic, where we monitor on the social media and other sources of information, incorrect information, fake news about vaccines, and then we factor this into the messaging that is distributed to people. I was very excited to hear the minister say that once the vaccination had started, this triggered a demand which is struggling to fill. We hope that when people realize that some of the concerns that arose when information started to emerge about adverse effects in the early stages of rolling out vaccines, now will understand that these are very rare events. These vaccines are safe. These vaccines are efficacious. When you're in a country, the government will choose the vaccine that is effective against the variant that is circulating there. So we are expecting that this is going to be less and less of a problem, but it does require a lot of communication effort.
Thank you, Dr. Moeti. It was great to hear from Lesotho because the Honorable Minister showed that things are going well. Honorable Minister, it would be good for you to let us know how Lesotho dealt with the issue of misinformation that other countries can learn from.
Thank you very much. We did have prophets of doom when we began this process. And we were also faced with the unfortunate event that our biggest neighbor, South Africa, rejected the AstraZeneca vaccine. Then that cost us a lot of need for information dissemination. But we insisted, particularly, that we can only rely on science and scientific pronouncements rather than hearsay. The other thing that we used was to get our partners, particularly the country WHO office here in Lesotho, was supportive enough to give us more information on the vaccines. And we were able to go on TV, radio, to explain the scientific side of things. The other important event that happened is that when we launched the vaccination program, we used our king, the Prime Minister, and a few ministers, including myself, to demonstrate that these vaccines cannot kill a person. So from that time on the very first day, we were overwhelmed by demand for vaccines. And all the health workers also helped us to understand and to give information to our people. So we have been very successful. We are extremely saddened to hear that African countries are able to return some of these vaccines. It's so unfortunate. But yes, let us have them. We need them so much in Lesotho. Thank you very much.
We congratulate the Kingdom of Lesotho for that success that we are talking about. So now to you, Anne Danaya, with development today. Kindly go ahead with your question.
Hello, can you hear me?
Yes, we can. Go ahead.
Thank you so much for taking this question. This is actually a question for a piece I'm doing for the Lancet. I would like to ask Ambassador Seydoux about comments made by President Macron at the G20 Global Health Summit on May the 20th. There he spoke about the need to correct the weaknesses of the ACT Accelerator. He called for a review of the Act A in view of making it more transparent and inclusive, in his words, if I understood correctly. I believe he also mentioned expanding the mandate of Act A to include manufacturing, in addition to the existing 3 or 4 pillars. So I would like to ask you, please, regarding these comments. Can you elaborate on what Macron means when he talks about the weaknesses of Act A? Regarding transparency, civil society has criticized Act A for this, but what are Macron's main concerns about transparency, and how can Act A be made more inclusive? And regarding the review that he mentions, can you say something about the mandate and timeline of such a review? Thank you so much for any information you can give on these points.
Yes, to you, Your Excellency.
Thank you very much for the question. Pardon, je parle français. Tout à fait, mais en fait, la question...
Indeed, the issue is the following. With this multilateral response based on solidarity and fair access that has given us very good results with ACTA, we were able to work collectively in an emergency situation. And when I say we, it's the international community, the WHO, the states, and all the international organizations that deal with health, foundations, and also the involvement of the private sector. So there was a collective mobilization based on solidarity in a context of urgency, of emergency. So there's been an effective access. We've monitored the situation with regards to therapies, oxygen, and also the situation for vaccines. And so we're not saying that ACTA has weaknesses because it's not functional. ACTA was functional, and again, France was at the origin of its establishment. The president participated and mobilized himself for that. And so ACTA must finish its job, continue to provide a collective response based on solidarity and effectiveness until we triumph against this pandemic of COVID-19. But we also must acknowledge that something that was created in a context of emergency is not always something that is the best model for the future.
Pardon, ce qui pourrait être la réponse de demain, ça c'est une autre discussion.
What would be the response in the future? Because we know that the international community, and this is being discussed at the World Health Assembly today, the international community is mobilized to build a better response for future pandemics. That's the first point. Secondly, now finishing the job with ACTA, and this is the French position, and the president has emphasized it during the World Health Summit. We need to continue to improve ACTA for it to deliver on its mandate. And now regarding transparency, we should be able to get some answers on the results that we obtained. And so what's the outcome? Vaccines that have been effectively administered, that's one indicator. the previous question dealt with vaccine hesitancy, and also what are the vaccines that have been administered, what is the result and outcome of these campaigns, and how the national plans benefit from ACTA. This must be identified in a transparent manner, and we needed also to know what were the costs, because the funding needs were very, very high. There are some costs that have not been covered, and so we need to know exactly how this funding was used, and this will help to strengthen this collective action. And this is where states have their role to play, because states benefit from this solidarity that emanates from ACTA, but all states should be able to show what results they were able to obtain. And of course, civil society, communities representatives also have a very important role to play in the development of health policies. And this is inspired by the experience we have acquired with the fight against tuberculosis, malaria, and HIV/AIDS. Communities have a very important role to play to fight against the COVID crisis. As Dr. Moeti has rightly said earlier, we need to fight against vaccine hesitancy, and for that we need to use communities as pillars that are very close to the population. And so this is the rationale. After this emergency phase, we are moving into a consolidation phase, and ACTA must meet its mandate until we triumph against COVID-19. And we need to be accountable on the results that were obtained in a clear and transparent manner. We'll need to have the support of all the states who have benefited from ACTA and who are part and parcel of this mechanism, equally for civil society. So we'll have to conduct an assessment, and we'll see what needs to be rectified, adjusted, and another assessment will be able to shed light on the discussions that are being held on the fight against the future pandemics we'll have to face. And now, regarding your last question on the emphasis that we should place on ACTA today, on manufacturing capacities. That's one of the emphasis of ACTA. That's something that France has identified for a few months now. On several occasions, our president intervened and said that ACTA should also focus on this matter, manufacturing. And the action was very quick, and from the different actors in ACTA, and this dialogue is being conducted under the aegis of WHO on the manufacturing capacities for mRNA. And so now ACTA will be focusing on the vaccine because it is what requires urgent action. But for France, this issue also addresses the possibility of enhancing manufacturing capacity in all countries. And so we'll have a plan, short-term, mid-term, and long-term. Of course, we need to find immediate solutions to optimize the present or existing manufacturing capacities, but we also need to take this opportunity to think in a profound manner on the sustainable manufacturing capacities at the global level in each region. And for Africa, France at the bilateral level within the EU and at the multilateral level wants to propose different initiatives. This is what will be discussed during the meeting tomorrow in South Africa. Thank you.
Thank you very much for that information, and we look forward to really hearing more from what comes from the discussions. So now the next question is from Omar Mohammed from Reuters, and it goes to you, Dr. Mihigo. Is Africa going to get the 20 million AstraZeneca dose vaccines by mid-July to deliver the second doses? And what will be the impact or if the continent does not get these doses?
Okay, thank you very much, Dr. Tuebwe. I think as we have heard in the preliminary introductory words by Dr. Moeti, the African region really is looking for completion of the second doses for those countries that have already started vaccinating. And our estimates currently stand to around 20 million doses that will be needed by July to make sure that the people who started vaccination and complete their series by then. So the objective of this appeal, both by Dr. Moeti, but also the Director General of WHO, it's really to make sure that, and we have heard the initiative from France in that regard, that the vaccine donation mechanism become a reality as soon as possible, while the COVAX facility is trying to diversify the portfolio of vaccine to make sure that we have enough doses in the coming month. So it's clear that, and we heard it very loudly from the Honorable Minister from Lesotho, that the trust, the confidence that the people have had on immunization for COVID could be altered if really these second doses are being delayed. So I think we do hope that we are going to meet that commitment. It will require a lot of work, a lot of commitment into action from those countries that have surplus doses to make sure that Africa can and should protect at least those people who have already started vaccinating. Now, in terms of consequence, I think WHO is currently reviewing all the data to understand what could be the potential or the consequence of a delayed second dose from the current 8 to 12 weeks up to 16 weeks interval between the two doses. And there are more and more data that are starting to emerge that is showing that, number one, people are not losing the benefits of that they've acquired after the administration of the first dose. Secondly, even if the second dose is a little bit delayed, I think there is a reason to believe that there will be no specific issue with that. And to conclude to that, today there is an extraordinary SAGE meeting that is currently being held now, that is looking at all the evidence that are starting to emerge from the real life delivery of the vaccine. And we hope that we're going to come back to the general audience with some recommendation around the vaccination schedule. But our objective is really to make sure that the country can receive these vaccines as soon as possible so that the second dose administration is not further delayed. Thank you, Dr. Tuebwe.
Thank you, Dr. Mihigo. And now I give the floor to you, Paul Adepoju from Nature, to ask your question.
Yeah, thank you very much. So I'd like to know Dr. Moeti's and other panelists' assessment of African public health institutions' performance in the light of the COVID-19 pandemic. I also like to know your opinions on concerns that vaccination delay on the continent could result in COVID-19 becoming endemic in Africa. Thank you.
Okay, thank you very much for those questions. I think that the public health institutions in African countries have done very well and have done a very good job. I think if we take the example of the Nigeria Centers for Disease Control, which I guess you would be the equivalent of a public health institution, they have managed to expand their capacity. They've gone work not only at the federal level, they've expanded what they're doing down to the state level and are starting to move beyond that level. They have built a lot of capacity extremely quickly in order for the public health institutes to play their role in countrywide, which is, of course, first to have been prepared for the pandemic and then to react and improve their capacity quickly for surveillance, diagnostics, to be able to track and know and anticipate where the virus was spreading and to ensure also that the preventive actions were being taken. So some of these institutes are relatively young. Of course, this is a new problem in Africa, and there are issues of capacity and resources. But I think that they have been up to the job extremely well, especially if we take the one in Nigeria, the one in Zambia, and other public health institutes. Clearly, as part of continuing to build the international health regulation capacities in countries and build this part of the public health systems, there is need to invest a lot more in all these institutions. And I just take the opportunity to say that as WHO, we coordinated joint external evaluations of the international health regulations capacities of virtually all of our countries. And all these countries have a plan where they've identified the gaps and they know what needs to be invested in order to fill these gaps. And we are advocating strongly that both from domestic resources and also from international support that these institutes be supported. Is there a risk that COVID-19 could become endemic in Africa? I think scientists in general think with a virus which is new, which is mutating all the time, as we have seen from the emergence of variants, and where, in the case of Africa, vaccination is not moving at the pace that we were expecting. The expectation, not only in Africa, but globally, is that this is a virus that we are going to have to live with in the future. And I think the main objective is to minimize severe illness, minimize mortality, deaths from this virus, and continue to develop the tools that are needed, particularly vaccines, therapeutics, to make sure that we don't have healthcare systems being overwhelmed when countries are going through waves, and that we minimize the harm in terms of deaths. We are very hopeful that once the wealthier countries have managed to vaccinate their populations, we are seeing that in some of these countries now, healthcare workers have been vaccinated, the elderly have been vaccinated, teenagers are being invited to come for vaccination. In the latter part of the year, we can have more vaccine access on the African continent and going into the early part of next year, so that we reach that level of vaccination that's needed to enable African countries to open up and return to a more normal life. So we are anticipating, hoping very much that it will not be endemic in Africa in ways that are different from the rest of the world. That demands the kind of solidarity, sharing of resources, building up capacity to develop and produce some of the tools on the continent that we've been discussing earlier.
Thank you, Dr. Moeti. Honorable Minister, it would be good to hear what you also think with these delays on vaccination in Africa. What do you think, what do you foresee that could happen to us?
Thank you very much indeed. We understand the challenges and do appreciate the challenges that we are faced with in terms of supply. And however, we are also gratified that with the efforts that have been made to unlock this logjam, there are two options for us. The way we look at it, the way I look at it, is that those who have surpluses should be kind enough to return the doses in time. It is also quite important for us that we seriously consider, or these countries that are producing these vaccines seriously consider the liberalization of the patent rights to enhance the development and production of these vaccines. Thank you very much.
Thank you. So the next question goes to Dr. Ngoy Nsenga. It's from Tobeka Ngema with the Daily News. And the question is, in one of the briefings, WHO Africa said they were concerned about South Africa heading for winter. What does WHO think when they see, read, and hear about what is happening in South Africa? What would be your advice to South Africa, especially with these factors and calls for stricter restrictions with the third wave ready to engulf the country? Over to you, Dr. Ngoy. Okay, Dr. Ngoy, if we...
Thank you very much.
Yes, go ahead.
Fran, and thank you again for the question. Can you hear me?
Yes, I hear you, Dr. Ngoy. Go
Okay,
ahead.
thank you. No, thank you. Thank you very much, Fiona. Sorry for the connection. No, I was saying first we have really to, I don't know if to congratulate or pay tribute to the government of South Africa, because we know South Africa is one of our countries that was most hit by the COVID in terms of number of cases. But at the same time, South Africa is also one of the countries that really fought hard to bring the situation under control. So South Africa, yes, the situation, at least in some part of South Africa right now, as Dr. Moeti said, we are seeing an upward trend and even resurgence in some provinces. Now, before even going to what should we advise or suggest to the government of South Africa, my reflection on that is, so far, Africa as a whole and the region in particular, we have heard a kind of a winning strategy. We are among the least affected country, region. I believe this is the right decision at the right time, both, the political leadership and the public health leadership in the region. So without a vaccine, Africa has not done so bad. That said, I'm not really trying to overplay our success because we are not yet out of the wood yet. But what I'm trying to say is, why should we overlook what so far has worked in Africa and try other? So at this, I want really to emphasize, before even going to what can the government of South Africa do, is what can the people of South Africa do as the President Kennedy used to say, before you ask what can the country do for you, ask what is really a disease that have highlighted the individual responsibility in the overall responsibility of the community and the country and the world as a whole. So we going back again to individual, trying to emphasize the need and the urgency of continuing to keep all the public health measures. Of course, now that we have the vaccine, and thank God we have the vaccine, and South Africa, again, is one of the countries that not only has contributed to the global knowledge in terms of science by conducting clinical trial and vaccine, but South Africa has also started rolling out the vaccine. And so far, at least according to the data that I have, more than 500,000 people is vaccinated in South Africa. That's a big step. So yes, now we are going into a situation where, because of the winter And because of maybe the circulation of the new trend, we are seeing another upward trend, or even the risk of resurgence. We need to go back to what made us to be successful in the first and the second wave, which were adhering to the public health measures, again, the responsibility of individual, and of course, the country as the nation has to take that balance between not closing completely the economy or the need for getting the economy going, but at least the need for preventing against getting into table. That's what, at least now, I believe the country is doing, and that WHO is helping the country to do. Thank you very much, Fiona.
Thank you very much, Ngoe. So now we go to our last question from Fanuel Adoli from ARD. And the first question goes to you, Dr. Mihigo. What is the worldwide percentage of the COVID-19 vaccine doses that came to Africa?
Yeah, thank you, Dr. Twebwe. The proportion is really minimal. As of today, only 43.5 million doses has been shipped to Africa, with around 28 million of these doses being administered to people. When we looked at the global supply, this represents less than 2% of the doses that have been made available globally to country. So I think we do have a real gap, an issue of equity, and beyond what we said at the beginning, which is needed to be done, I think there is a need really to accelerate the pace for the delivery of the vaccine. Thank you.
Thank you, Dr. Mihigo. And now the last one to you, Dr. Moeti from Botswana TV. And the question says, Africa's healthcare systems are overwhelmed right now. What are our plans beyond COVID-19 in healthcare, from challenges like doctor-patient ratio to improvement of facilities?
Yes, I think that's a very good question to conclude on, to make the link between responding to a pandemic like COVID-19 and building the basic healthcare systems in countries and progressing towards universal health coverage. We know that there are significant gaps in capacity of the healthcare systems in Africa, starting from the primary care level, the facility which is nearest to where people live, the intermediate or district level, as it's called in some countries or provinces, and then the central level. So I think what we can do is to implement what has been decided at the political level globally, at the United Nations, at the political level in Africa around universal health coverage. So meaning there is need to invest in health. We realize that problems with health can destroy your economy. So no longer think of health as that luxury, whatever, which is what was the thinking in the past. And we need to invest in health in ways that are targeting very much equity, because we've seen that if some people are looked after and others are not, the vulnerability in the whole of society is there. And that means the entire healthcare system, starting from healthcare workers. We have huge gaps in Africa. We need to train more. We need to create conditions where we will retain more of the healthcare workers of different professions, motivate, reward them, distribute them fairly so you don't get concentration in cities and nothing happening in rural areas. And look at other facilities, infrastructure. I think that with technology being available, we have huge opportunities to jumpstart some of these changes, including remote consultations in the current context, so that people don't have to go to a doctor to actually get advice about their healthcare. So I think that this is a big opportunity to move on an agenda that's already very much been agreed upon, and to link it with resilience to a pandemic, and in fact, the response to the COVID-19 pandemic today. And we as WHO are working with partners and governments to pursue this agenda at the same time as supporting the response to the pandemic.
Okay, thank you, Dr. Moeti. So we are coming to the end of this virtual press conference, and I'll request our panelists to give us their closing remarks, and we have a minute each. I'll start with you, Honorable Semano Henry Sekatle, the Honorable Minister of Health from the Kingdom of Lesotho.
Thank you very much for having us. It has been a fruitful and informative discussion. We have learned in Lesotho that the so-called waves of this pandemic are in fact a direct result of our day-to-day decisions. We need discipline, we need resilience, we need to be altogether focused on preventing rather than dealing with the cases of COVID. So thank you very much indeed. Thank you, Dr. Moeti.
Thank you, Honorable Minister. And as I hand the floor to you, Your Excellency Stéphanie Seydoux, in your concluding remarks, could you also help us address the question that what can we do for Africa to get equitable distribution of the vaccines?
Merci beaucoup. J'aimerais dire trois choses.
Thank you very much. I'd like to highlight 3 points at the end of this press briefing. First of all, as was highlighted, Africa played a major role at the highest level for political mobilization and mobilization of the scientific community. And the region is a very important actor in terms of mobilization. We've seen the positions adopted by its leaders and also the great progress made by institutions like CDC Africa and the role played by the African Union. Africa co-chairs the board of ACTA, and we've seen scientific excellency through the experience of different scientific centers on the continent, like the Pasteur Institute in Dakar. It is something very important, and it goes without saying, we have leaders from Africa that head the WHO and the WTO. And so leadership is exemplified by these leaders. France has mobilized itself from the outset, it remains mobilized, it will continue to be mobilized, continue to support financially, and there's a new 500 million euros that will be added to ACTA. We've been mobilized at the political level for our partners to give doses and share doses and to support the enhancement of manufacturing of vaccines. And to answer your question, these are the measures that are the most important for France that we need to enhance. And finally, I'd like to come back to what Dr. Moeti has said. It is the vision we need to have, make our systems sustainable. We see with this crisis that investment in health is an investment that supports economic development. There was a support on the 18th of May for economic support of African countries that has identified different measures to anchor this idea and also to prevent pandemics in the future and enhance development capacities at the global level, a message that is being defended by Africa. And this can be transformed into something very positive for universal health coverage. It is a global objective, and France supports the implementation of this objective. And if we continue to play, continue to act in a collective manner and based on solidarity, I think that this crisis will be an example that will help us move forward and not regress. Thank you very much.
Thank you very much. Very reassuring words and optimism right there, Your Excellency. So last but not least, to you, Dr. Moeti, and in your concluding remarks, would like you to answer this question. The World Health Organization was reviewing the COVID-19 data from Seychelles following the spike in cases despite a high rate of vaccination. Is it possible to update us on the progress, if any, on what could have been behind this rise?
Yes, thank you. Thank you for that question. We know that Seychelles is, in fact, one of the most vaccinated countries around the world. About 63% of their population is fully vaccinated. However, they have seen some cases after a big vaccination drive had been carried out, and also 35 people have died. In addition to that, we know that the B1351, so the variant that was first identified in South Africa, was also identified in Seychelles, though it's not clear to what degree it is circulating. I think the most important takeaway from this is that, yes, indeed, people who were vaccinated also became ill. But what's also very clear is that of those who became severely ill, requiring to be hospitalized, 80% were among people who were still unvaccinated. And the most critical cases were all unvaccinated. So we know that these vaccines will not necessarily stop you being infected by the virus, but what we are looking for initially as benefit and value from the vaccine is preventing severe illness and preventing death. So I would say that this is a situation in the Seychelles at the moment. I know that the government and we have sent an expert there to support the analysis further to understand what happened. But what we do know is that certainly there were not among people who were vaccinated severe illness and deaths, and therefore the benefit from that vaccination did happen. I'd like to conclude then by again thanking very much my fellow panelists, Honorable Minister and Ambassador Seydoux, for having joined and shared with us your perspectives, your experiences, and your recommendations for the future. And just conclude by saying that we in WHO advocate strongly for this solidarity in sharing vaccines now and in sufficient quantities to make a difference in the African region and to cover the gap of vaccination of African people. And we'd like to say that this is very much solidarity, it is support for a region, but it's also self-interest, because we know that as long as the virus continues to circulate highly in some regions, mutations will occur, variants will occur, and we will have the problems, even in countries where vaccination has been carried out, of having to always contend with these variants coming in. So it really is solidarity, but also looking after oneself. And finally, for our countries in the African region, we are having reversals. The pace is slower than we expected in terms of vaccine acquisition. I'd like to urge that we use this time to catch up, refining our planning, making sure that we are putting in place all that is required, that when the vaccines arrive, we roll them out in ways that in some countries need to be better than what is happening now. We have a significant number of countries that have received vaccines, but where quite significant proportions are still not rolled out due to capacity issues, financing matters. So I'm really urging that, and we are here as WHO to support, to review the plans and make sure that the readiness is such that as the vaccines are arriving, we're able to roll them out like those countries that have managed to use 100% of what they received. Again, thank you very much to our colleagues, journalists, for having joined us today.
Thank you very much, and indeed sincere gratitude to you, our panelists and our journalists, for joining us today. We are at the end of the press conference, and do have yourselves a good day.